And my job is to introduce this incredible panel. I wanted to start with some storytelling. I wanted to, first of all, let you all know that this rounds is going to be a little bit atypical in that we are not doing slides. So you're just going to see our faces and hear our voices. And hopefully for people who are listening in, that way you will get the whole content. The title of this Grand Rounds is Team Lily and HIVE Present. Updates on housing and substance use policies in San Francisco. And before we get started, I just wanted to make sure everybody knows who HIVE and Team Lily are and tell a little bit of our origin story, specifically around Team Lily. HIVE is a program that has first started as BAPAC, the Bay Area Perinatal AIDS Center. Actually, I can't remember if it's center or clinic. Rebecca Schwartz, who's in the audience, can remind us in the chat if she's able. BAPAC transformed into HIVE and cares for people who are living with or affected by HIV and their families and support their parenting and family building goals. HIVE has been around for a very long time and has provided robust services, wraparound services for anybody who is affected by HIV, and has really led the way in terms of providing patient-centered and family-centered care. And for those of us who were connected to BAPAC and HIVE in the past, that origin story and that kind of existence of HIVE really led to the birth of Team Lily. I wanted to highlight that because it really is an advocacy story, and for the learners and the trainees in the virtual room, I wanted to pick up on the theme from last week's Grand Rounds with Dr. Carolyn Suffren, who talked about seeing a problem, recognizing if there are a group of people who aren't being counted, and recognizing then that when we don't count people, they aren't seen, and therefore we can't advocate for them. And I think Team Lily is specifically a story of that. So back in 2018, there were a group of social workers and nurses and providers on labor and delivery units who are all seeing this increasing influx of people coming into our labor and delivery units, our family birth center, who had little or no prenatal care. Those individuals were frequently affected by homelessness and substance use disorders, and they were coming in. We as care providers really did not know how to take care of them in a supportive way. They were having extremely traumatic births. Frequently after their births, CPS was called rather quickly, and they were separated from their babies and left the hospital really feeling like they were not only not supported in their birth, but were specifically harmed. This was obviously awful for our patients, and it was also awful for our care providers who come to this work trying to build families, support birthing people, and helping people to have the births that they want. And from those experiences, a multidisciplinary group of people came together and said, you know, can this be different? And we looked to HIVE, where things really were happening differently. Patients were coming in who had histories of homelessness, who had histories of substance use disorders, and those individuals were being supported throughout their prenatal care and having beautiful births. And our question was, could we do the same thing for families and individuals who are not affected by HIV? Really importantly, I highlight that time around 2018 because while the housing crisis had been happening, it was really starting to take off. Fentanyl was starting to hit the scenes in San Francisco. Methamphetamines were starting to hit the scenes in San Francisco. So there were these whole confluence of reasons of why we were seeing more of these pregnant people come into our care. And from that recognition, the first question we had was, how many of these individuals are there? And we asked the city that, and they had no idea. The city did not know the number of pregnant people who were unhoused during their pregnancy or at birth. The city did not know the number of pregnant people with substance use disorders. The city did not know the number of pregnant people who had no prenatal care during their pregnancies. And so for all of those reasons, we really recognized very early on that this was a group of people who were unseen, uncounted, and therefore uncared for. They weren't in the city budgets in terms of all of the support systems that very frequently didn't explicitly exclude pregnant people, but on the ground, they absolutely did not welcome pregnant people into their services. And more than that, when we as service providers would go and ask if this pregnant person could come in, people would come up with all kinds of reasons for why a pregnant person would not be allowed to stay in that shelter or enter that substance use program. So with that, Team Lily was born. Team Lily is a multidisciplinary care program for pregnant people in San Francisco who are affected by significant barriers to care. Now, I mentioned substance use disorder and homelessness because about 95% of our patients experience homelessness during their pregnancy. About 30% are unsheltered. About 80% are affected by a substance use disorder. And really importantly, that's not everyone. So we also take care of people who experience other barriers to care. So for example, people experiencing incarceration during pregnancy, people experiencing significant IPV, anything that makes it a challenge to get into a four-walled clinic are the patients that we strive to care for and support. Our goals in Team Lily are to basically provide wraparound services, starting with whatever that individual identifies as what their most pressing need is, and starting from there and building a care team around that need. I wanted to shout out our care team providers. Our team includes navigators, social workers, therapists, mental health clinicians, and physicians, as well as our amazing team manager, Cynthia, who I'll introduce in a moment. They work so hard to provide those wraparound services and support throughout the week. We do have an all-day clinic on Thursdays, which is a drop-in clinic, and the real work of our program happens throughout the week, doing home visits, visits to where people are in the community, meeting people where they are at. At this point, our team cares for about 100 patients a year who give birth, and we have expanded to the Family Health Center where we care for approximately 200 unique individuals every year who are postpartum, and that clinic involves both postpartum care and primary care, and we continue to grow. We're really trying to meet the needs of individuals and patients in our city, and I think historically, again, while we started as a care team and a care program specifically focused on clinical care, and I do think that our program has always been an advocate in terms of advocacy for our patients. The reason we are hosting today is because Team Lily strives to be much more than that, and also to advocate for policy changes that affect our patients and our clients so that we can ultimately hope that one day programs like Team Lily are not necessary. And so with that, I wanted to transition to introducing Cynthia Gutierrez, who is our program manager. Cynthia is a fierce reproductive justice advocate. She has a tremendous amount of experience working in the realms of, as I mentioned, reproductive justice, and more recently has worked in the realm of disability justice. And I really wanted to appreciate her for bringing that advocacy into our department and into our division. Cynthia sits on the board of Access Reproductive Justice and Sister Song, and really leads Team Lily in our advocacy efforts. Specifically, I wanted to highlight how a couple of years ago, when the Oasis Shelter, which is an emergency crisis shelter for families and people facing IPV in San Francisco, was being shut down, she and Jennifer, who is on this panel, really led incredible advocacy efforts to keep that shelter open. There was a rally outside of City Hall, which many residents attended. Thank you to all of those residents and other faculty who were there. And thank you especially to Cynthia and to Jennifer and to all the people who stood up, because that shelter continues to house many of our patients and is a tremendous resource for our patients and clients in the city. So with that, I'm going to transition to talk to Cynthia, who's going to introduce our panel. Just to talk for a second about the framing of this panel. Our goal is to really give you some snapshots into key issues in San Francisco that are affecting our patients. We hope that you will walk away from this First of all, understanding the context that our patients and clients are bringing into the room. I think it can be very challenging when we read the Chronicle or we listen online to the robust amount of services in San Francisco. And then we see people in front of us who are unhoused, unsheltered, and who have not been able to access treatment for their substance use disorder. And there's a disconnect. And we hope that today we will share with you some of the reasons why those disconnects are happening and how our policies, while they are often well-meaning, sometimes less well-meaning, that doesn't always trickle down to how it impacts the specific individual. And we hope, again, today you'll walk out with some both understanding of what our patients are experiencing, as well as next steps for how you can advocate to change the systems and the policies. Very briefly, I wanted to mention that this is an advocacy grand rounds. Each of the speakers on this panel are speaking for themselves and or their organization, not for UCSF. And we really hope that we can continue to have a good conversation today. There will be time for questions at the end, so please be welcome to put them in the chat as we go. We look forward to hearing from you. And thank you again so much to our panel. And I will pass it on to Cynthia.
Thank you. Good morning, everyone. Again, my name is Cynthia Gutierrez. My pronouns are she and ella. I am zooming in from Deep East Oakland, and I say that intentionally because there are the issues that we're seeing in San Francisco. We're also seeing it in my part of Oakland. I am here to introduce Jennifer, and then Jennifer will have a moment to speak. I'll introduce Laura. Laura will have an opportunity to speak. Um, I'll start off with Jennifer's bio. Jennifer is currently the executive director of the Coalition on Homelessness San Francisco. She has worked for the coalition for 30 years as the executive director, organizing director, substance use and mental health work group coordinator and fundraiser. During her tenure, she has achieved several significant victories alongside homeless people, including most recently crafting and leading a winning campaign for Our City, Our Home Prop C, which appeared on the November 2018 ballot and doubled San Francisco's current efforts to solve homelessness. Other accomplishments include the creation of a local housing subsidy serving hundreds of homeless families, and in addition of thousands of housing exits for homeless people. She continues to work on halting the displacement of households, expanding substance use treatment, and spearheading a lot of legislative reforms protecting the rights of homeless people. Jennifer also has many awards. It would take a good even 10 minutes to list all her awards. But on a personal level, I just want to say, for those of you that know me in the department, I love to identify a problem and be in the solution, right? And I feel that Jennifer really embodies the spirit of working for the people. I have the greatest honor to see Jennifer in action in the streets, not only protesting and advocating in that way, but also in meeting spaces at City Hall. And so, Jennifer, from Nika and my heart, we are so grateful for all that you do for people in San Francisco, for folks that are truly struggling. And I'll pass you the mic so you can share about your work and tell us how things are looking for you in our current state.
Thank you so much. And thanks everybody for having me here. And also thanks for all the work you all do. I feel like the medical profession, like you're in this unique space where folks are coming to you. You have, oftentimes you're in this place of heightened trust. And then that also translates over to when we're doing advocacy and organizing. And so, I just we've seen the medical community stand up in so many instances locally in San Francisco in such an effective way. And so this is really awesome. I'm really happy to be here. So the little bit about the coalition. We do a ton of outreach to unhoused people. We have kind of a housing justice work group, which is open, made up mostly of people with lived experience with homelessness and mostly families. And then we have a human rights work group, and basically we take what we learn out on outreach, bring it to the work groups, and then develop campaigns and push for change. And sometimes that's responding to really bad ideas. But we try to always simultaneously push for proactive change, and are really conscientious about that because, of course, in San Francisco, homelessness is kind of the main wedge issue, that's been used for decades by, politicians to elevate downtown interests. And much like Trump uses immigrants and Muslims, it's very similar. And so that unfortunately has led to a lot of really bad homeless policy, and a lot of bad rhetoric that's really, honestly pretty hateful towards the community. That more recently has shifted over to, I think we managed somewhat to kind of push this back and say it's not okay. And now they're sort of shifting over to drug users as sort of the group to demonize, in order to, the way wedge issues work, it, attracts more money into the campaign coffers and gets you headlines. And, it's a very specific political strategy. It's very unfortunate. So, basically, I wanted to kind of just talk about homeless. Well, I wanted to focus a little bit on homeless families, but talk about some upcoming advocacy opportunities and stuff like that. But the big picture on homelessness is we've seen this huge disinvestment at the federal level on housing. Rents keep rising, and then people's income doesn't keep up. And that's really the root of homelessness. It's not more complicated than that, except that as people are homeless for longer and longer, you see much more complications. You see their medical condition deteriorating. You see increased rates of substance use and mental health. Even though that may not have been the thing that caused homelessness, and for very few people it is, there is this intersection. So in other words, as we as a society force people, because we don't, we have thousands and thousands of people on the wait list for housing. As we force people to be homeless, it gets more and more difficult for the individual, and more and more costly. So we're spending more money keeping people homeless than we are if we had just simply housed them to begin with. There's a lot of data that kind of backs this up. And then the municipality response, because they don't have the tax base to, invest in the housing that was once, provided by the federal government, has responded with an enforcement approach that kind of manages the situation and tries to push it out of public view. And that's what we're seeing, literally today on the streets every day. And it's very counterproductive. One of the things that's happened in all of this is that homeless families have been really ignored. And the proportion of resources directed towards homeless families is much smaller than towards single adults. We saw between the last homeless count in 2022 and the current one in 2024, a doubling of the number of families experiencing homelessness. We're seeing a huge number of families living in RVs, but also in a lot of other spots, in terms of doubling up in unsafe situations, moving around in hotels, out on the streets, and a lot of pregnant folks as well that are out there. And so we had this ballooning of the number of families on the wait list for shelter in San Francisco, which is a pretty onerous process to even stay on the wait list. And so the city responded by basically changing the eligibility for shelter so that a huge chunk of the families got put off of the wait list. And they really weren't given any other alternative options, but it was families who are in hotels, and families who are doubled up. In our experience, a lot of folks are presenting, but when a mom comes to shelter, and it's primarily single moms, they're in a really bad situation. And so, you really, the system should just embrace them and know that that's an alarm bell, instead of pushing them away. And so there's a lot of moms are having to engage in survival sex for a place to stay. You have unsafe conditions at the house that they're kind of putting up with because they have nowhere to go, but it's not great for the kids. All of these situations, the hotels, we've had, mom with a kid in a wheelchair in a 5-story walk up in a hotel. Sure, she's got a hotel, but she's literally trapped. The kid's too big now to carry up and down the stairs. So, when they're presenting and, having these really severe situations, we should take it seriously. The other thing they did is they put a length of stay policy on there that limited it to 90 days and then extensions 1 month at a time, but it was supposed to be implemented so that if the family was homeless through no fault of their own, they would get a 30-day extension, 3 of those, and then to the city. But it was so confusing, nobody knew what was going on, and so they ended up giving everybody an extra 30 days, a lot of confusion. Their families have access to due process. They didn't allow them to have that. If they, and then some of the shelters just kicked everybody out en masse. And then we had to work to try to get those evictions overturned. And so it's been a big, big mess. So the families presenting to you that, that are in shelter, are probably under a lot of stress right now. Basically, that we're responding both kind of on an individual basis with the city on these individual cases, but also really trying to get a policy that makes more sense for folks that the families are asking for more stability. They're doing all the work that they can to get housing, but this is really causing a lot of additional stress. So, but also legislation, and we're going to have Supervisor Fielder from the Mission District in Bernal is going to be probably putting forward some legislation. There's also a resolution on homeless families that she introduced that's going to be heard in early April. We can let folks know about that. We're also have this proactive push for housing. Like, look, you're upset that there's a big wait list and people aren't moving on the wait list. Well, there's better ways to move on that wait list and get people into housing. And one of the frustrating things they did is they put eviction notices to all 900 members of families, the 600-700 kids before the new subsidies dropped. So there's more subsidies that are dropping this month that we fought for and got out of the mayor's office through Prop C funds last year. We also have, cuts that might be coming down. We're still going to be pushing for housing for families. We don't think anybody, we think we can afford to, stably house all our families. And we're also pushing for safe parking so that the families have said that live in the RVs, they just want a place to park. They'll manage it themselves. They don't need much else. But they're really getting targeted very heavily by MTA and police, and that's causing a lot of instability and stress. So there'll be advocacy opportunities through the legislation with families, through the budget struggle. We can talk more if you're specifically interested in, put your email in the, you can message me in the chat with your email and I can add people and we can keep you informed of places you can go. And of course we can communicate directly when we have big events coming up through Cynthia. Yeah.
Great. And I also put your organization's web page in the chat. I know, just to say, y'all, this Coalition on Homelessness, they send you emails, they keep you informed. Like, I feel like there's so many ways to be engaged, and we really need all hands on deck. So, Jennifer, thank you. And if folks can go on the website and just find ways to stay connected with Jennifer, that is greatly appreciated. I am going to now introduce Laura. So Laura is the Senior Director of HIV and Harm Reduction Policy for the San Francisco AIDS Foundation, where she is leading work on drug user health, harm reduction, and access to treatment. She has been advocating on HIV and public health issues for over 30 years, since being involved in AIDS activism through ACT UP in San Francisco. She previously worked at the Drug Policy Alliance, a community-based organizations in San Francisco, and the San Francisco Department of Public Health. She graduated from the University of California, Berkeley with a master's in public health and a master's in public policy. Laura, thank you so much for being here. Nika and I have had the pleasure of getting to know you and learning about your work, and would love for everyone else to learn more about what you're working on right now.
Wonderful. Thank you so much for inviting me. I'm managing some cat drama in my house, so my kitten may show up or yell on screen, but usually people don't mind the cat walking across my keyboard as long as he doesn't disconnect me. Thank you so much for inviting me. And I am privileged to get to do a lot of work with Jenny Friedenbach. So happy to tag team with her here. San Francisco used to be a model city when it came to drug policy and harm reduction and services for people who use drugs. It doesn't mean that we've ever been perfect. There's never been enough substance use disorder treatment to fully meet the needs of folks, nor has harm reduction ever been fully funded, and it's always been a sort of volunteer-led service. Nonetheless, there was a point in time when we had a district attorney who was committed to diverting people out of the criminal justice system and providing other services instead. We were able to stop the city from building a new jail. San Francisco has a long history of being at the forefront, whether it's around, marijuana or psychedelics, just being at the forefront of both sort of changing attitudes around drug use and people who use drugs, but also providing services and changing laws and regulations. So what happened and how did we get to where we are now, and where are we now? So at the moment, you may have seen the headlines yesterday from the mayor has this new policy, new set of policies that is described as breaking the cycle around a number of issues, including being unhoused, mental health, and substance use. Unfortunately, what he is proposing is going in the wrong direction. It's not breaking the cycle. It is tightening down the cycles of criminalization, trauma, destabilization, and it is, which are all things that we know lead people to use more substances, exacerbate their substance use. We know from the literature on human behavior change, all of us are more likely to make behavior changes when we are in a position of some stability, right? So, this is all of a piece with everything that Jenny was talking about. And, we have gone from a place where we were sort of trying to humanize and make services human-sized and person-centered to now we're very concerned about our streets and our sidewalks. And if we've got this like healthy streets and drug-free sidewalks, like it is now very clear that what we care about are not the people on the streets or the sidewalks, it is the streets or the sidewalks themselves. And so, I've lived in San Francisco for over 30 years. Like there's a lot of distress, human distress on the streets that is hard to be a witness to. It is hard to see that. It is hard to be present for it. But I feel like some of us respond to that distress on the sidewalks and on the streets by being moved to take care of folks. How did they get here? How do we help move them into a place where they will be in less distress? And other people just want to move those folks out of view. They don't have to see them, problem solved. And so that is a lot of what is happening right now in the city. Is first people were moved out of the Tenderloin to the South of Market. Now they're being moved out of the South of Market into the Mission. The next focus is going to be on the Mission and moving people out of the Mission. None of this is actually solving the problem. The mayor wants to put people on buses to where, and so it creates these challenges for us. How do we show up in this moment? How do we show up for the people that we care about? How do we push back on some of this? And one of the things that is incredibly frustrating right now, and it is happening at the national level, it's happening at the local level. There is such a discrediting of the public health research and evidence and information. And it is, I'm a person trained in public health. I've worked in public health like my entire adult career. It is frustrating to watch at the federal level as, the person at the head of the Secretary of HHS says he's not entirely sure that HIV is the cause of AIDS, right? But at the same time, we've got a mayor who is very clearly saying, I don't care what the evidence is. I want you to stop providing harm reduction supplies. Despite all evidence to the contrary, I believe that handing out these supplies is enabling drug use. And so it's, you know, it is hard to be fighting these on all levels. And I think, you know, one of the things that is helpful in this moment, and one of the ways to get involved, is especially for people who, you know, can speak with the authority as a medical provider, as a clinician, as somebody in the medical field, to stand up and say, actually, the evidence is very clear that harm reduction works, that, you know, destabilizing people is harmful, that encampment clearances increase people's overdose risk. For example, overdoses go up. And, you know, one of the sort of points of contention right now is the is smoking supplies. So, you know, 2018 is when fentanyl started to arrive in San Francisco. Fentanyl is an illicit opioid. As many of you know, fentanyl has a long and important role in medical practice because it is a very fast-acting and short-lived opioid. When it started showing up in the San Francisco supply, a lot of people switched from injecting the black tar heroin that they had been using to smoking fentanyl. From a harm reduction, from a public health perspective, that is a win. If people are not injecting, they eliminate all of those HIV transmission risks. Viral hepatitis risks go down dramatically. Soft tissue infections, all of these things that even with sterile syringes, you're potentially at risk for, go away. And so from an HIV prevention perspective, people using a different route of administration, smoking or inhaling their drugs, is a solid win. And yet that is the piece that this mayor is focused on, is how do we stop people from smoking their drugs? The only thing that, in the absence of enough treatment in the ways that people need it and want it and can show up for it, that will only increase our HIV rates. That will only increase people's HIV vulnerability and viral hepatitis vulnerability. And so that's one of the places where folks being able to speak up and say, actually, no, it's really important to be distributing foils and pipes. If you can distribute foils and pipes to your program participants, you know, and just generally how to support patients in this moment. I mean, some of it is just what you're already doing. Humanize people, engage with them as people acknowledge these attacks, check in with them. But then on a larger level, just to challenge the misinformation. You know, if there are questions that you have, figure out how to get that information, challenge the misinformation, give supplies if you can. I want to give a quick shout out to an organization called Pregnancy Justice. They used to be called the National Advocates for Pregnant Women, and they've been particular, but they changed their name to be more inclusive, particularly focusing at the intersection of pregnant people and drug use. And you've already got it. I've got it all queued up, and you are faster than I am, Cynthia. You know, because even here in California in 2019, a young pregnant woman named Chelsea Becker was charged with murder because of the death of her fetus, which they claimed was because of her methamphetamine use, even though that is medically not plausible. And so, you know, even here in California, pregnant people are being criminalized because of their substance use. So, thank you so much. I'll stop there and see if you have any questions for Jenny and me. I'm happy to answer them. And just thank you so much. And thank you for taking care of the people that you take care of. You know, we know that this is an intersection where, you know, race and gender, the extent to which reproductive rights are so under attack right now. So thank you for being there.
Thank you so much to our incredible panelists. And I just wanted to appreciate and uplift what Ana Delgado say, which I completely echo, which was thank you for giving us practical information. I really, I'm going to hold that concept of people versus sidewalks as I read articles, and I think we can all use that lens to look at the policies and the publicity that our city and our country are spotlighting on people experiencing homelessness and with substance use disorders, and really push ourselves to remember that we're here to take care of people and take care of their health conditions, and try to work on the policies that are putting people in so much distress. So with that, I'm going to see if anybody has questions. Feel free to either put them in the chat or unmute themselves. And if people don't, then we have some questions from the panel as well. Looks like Katie has a question. Go ahead, Katie.
Thanks. I'm sure other folks do too, but Jennifer, I wonder if you could tell us a little bit more about the specific policies you mentioned that I think it was Councilmember Fielder might be introducing both a resolution and some other legislation. And I'm asking this specifically as from the advocacy committee, and as I've been taking notes, looking for ways that we might be able to funnel information and opportunities for action back out to the department when specific things are coming up that folks could weigh in on.
Yeah. So the resolution is basically just drawing attention to the increasing homeless families and calling for solutions kind of a thing. And it's an opportunity for a public hearing to kind of raise awareness about this issue. The legislation is in its very infancy stages, but the idea is that it would require the city to restore the wait list and have some protections in place in terms of the length of stay, really calling out that people have, their due process rights should be respected. And I don't know yet how the supervisor is going to go, but there's going to be some weighing in on the length of stay, either rescinding length of stay or calling for a longer length of stay off the top. And so that has not been introduced yet.
I wanted to jump in for a second and just build on what Jennifer was saying about a length of stay of 30 days. I wanted for all of us to think about as clinicians, when we see people and families who are trying to stabilize and how quickly 30 days goes by, and whether people can actually stabilize and move forward and find a new place to live in 30 days. When we think about that in terms of our actual patients and clients and even ourselves, I think all of us know that 30 days is completely unrealistic. Just as an example, there also are other policies in the city around 1 week to stabilize and move on. And so when we look at those types of policies and then think about our patients and clients, I think one of the places that we can also push back is to show from our medical experience that it takes a lot longer than a week or 2 weeks or 30 days to be able to move on to people's next steps, especially when there are not clear next steps in a city with very entangled policies and very unclear eligibility requirements. So I wanted to really appreciate Jennifer for pushing that legislation forward and just reminding all of us how broken our policies are when we're taking care of these families. I'm going to go to Ana Delgado in this chat. She said, how do we get notified how do we get notified when showing up somewhere in white coats to testify or hold spaces could be helpful? I feel like sometimes I hear about these opportunities too late, and we need to be using our power and privilege more in these advocacy spaces. Thanks, Ana.
I love that. I mean, I think it's on us to be more organized about it, but first of all, getting on for Coalition on Homelessness, not to be self-referential, but get on our action alert. And then we send out when there's like big actions and stuff like that. But I also think like it worked really well when the Oasis example of working through Cynthia and then Cynthia letting everybody know. Ideally, we are planning an action 2 weeks ahead of time, and that's enough time to kind of like get the word out. But sometimes things happen and we have to do things spontaneously, which makes it tougher. Those are two possibilities. The third possibility, and especially if you're interested on the family homeless stuff, is to join our housing justice work group. And you basically get put on the listserv and the notes are there and we're talking about stuff, and that's kind of like the most notified group Cynthia's on that listserv also. But that's a third possibility, and you can let me know and I can add you.
And so a couple of things out of San Francisco AIDS Foundation, we have the HIV Advocacy Network. Obviously, it has an HIV focus, but it is inclusive of harm reduction and treatment. And you can join that, and we send out action alerts. You can also join our meetings where we set our agenda for the year and prioritize things. Jenny and I are both part of the San Francisco Treatment on Demand Coalition. That is also a place for advocacy. We need to get better organized around our email list for that group, because currently we mostly send out information about meetings, which is not what you're asking about. But I think, it is always so great to be able to get medical providers and clinicians and doctors to show up. You carry such authority in the world, whether you feel it in the moment or not. And so being able to, we did that last year around pushing back on Proposition F. We were able to get a number of medical providers to come together and make a statement in pushing back on taking away people's general assistance payments. So it is, but I agree with Jenny. It's sort of on us as the advocates to figure out how to make those connections easier and make it easier for people to engage with us. But thank you.
Laura and Jenny, I had a follow-up question for you that I'm going to take the moderator privilege to ask. I think one of the other big hot topics and shifts that we're seeing around the country, and specifically around San Francisco, is around giving people ultimatums of either you go to treatment or you go to jail. You give negative urine toxicology tests or you get your benefits. I was wondering if you could talk a little bit about if we have any evidence or data around whether those programs work, and B, if either of your organizations are advocating around those types of issues.
Yes, the shortest answer is yes. I mean, the evidence shows that people who access services voluntarily, access substance use disorder treatment voluntarily, have better outcomes than those who are forced into it. It doesn't mean that people being forced into treatment never works. And so you will often hear stories from people saying, getting arrested was the best thing that ever happened to me. The same way that, you sometimes hear people say things like getting HIV was the best thing that ever happened to me or something. And it is, people's narratives are their own narratives, and I want them to own their own story of their life. And at the same time, on a larger population level, we absolutely have better health outcomes for people who are able to access treatment when they want it in ways that are culturally, linguistically, gender appropriate, right? That are affordable for them, that meet their needs. And that's what we're often lacking in San Francisco. So it's, we get into this place where people are like, if we just force people into treatment, we just have to make them go to treatment and then everything will be solved, which misses the reality of substance use treatment. Like treatment for many other things is, it is not always linear. People have different paths to recovery. It may take a while to find the right medication that works for folks or the right treatment that works for folks. Again, same with, many other health conditions where you have to, try something else. It needs to be person-centered, and you need to be both evidence-based and, have some grace for folks sometimes. So we do have evidence that this kind of coercion is less effective. It's often counterproductive as well. We have instances where you go through some of these like drug courts and people end up sitting in jail longer in a very traumatic situation, sitting in jail longer, waiting for a treatment bed to open up than they would have if they had just pled guilty to the charge and just served out their term in jail. That is obviously like not achieving any of the goals that we have for it. So it's that's very much what the evidence shows. So it can work, it can be effective for people, but on a population level, it's really counterproductive.
Yeah, and just to add to that just a little bit is that we have such scarcity of resources, and it's kind of like, why are we mandating people into treatment when the people who are trying to get treatment aren't able to access it? And so, there's an accountability issue there. The programs a lot of times are measured by participation. And so when programs have really low participation, it usually means that they're not that effective. And so those are usually the programs that are advocating for mandatory treatment, just to say, because they want to have a way to fill up their units of service to be able to get the contract. So there's another kind of more sinister side of this that that's unfortunate. Yeah.
Thank you so much. One thing I've learned from advocates is to start on time and to end on time. So I wanted to thank you all so much for joining our panel. Thank you for all of you for joining today. Thank you for taking care of our patients. And thank you in advance for signing on to these advocacy listservs and showing up and, just like Anna said, using our power and privilege to try and change some of these policies that are really not person-centered and are putting sidewalks above people. So thank you again. And thank you as well to the advocacy panel for hosting